The benefit of epidurals is that there's very little effects to baby at all. Because we're able to deliver medications straight to the area around the spinal cord, very little medication enters your bloodstream, and effects to baby are little to nothing. There is a common misconception that epidurals slow down the labor process. There's been a lot of research done in that area. And for the most part, during your early part of labor, where you're just having uterine contractions, we have pretty good evidence that it doesn't necessarily slow things down. You also receive a fair amount of IV fluids to help prevent a decrease in blood pressure with your epidural placement, and that may be actually what slows down your contractions, is receiving some extra IV fluids. There is some evidence showing it may slightly prolong the length of pushing. At the most, it looks like about 15 minutes is all it extends. We encourage women to get an epidural when you feel like you're still in control of your pain. It does take time to place an epidural, and we do have you sitting up at bedside when we place the epidural. So we want you to be able to still be in control of your contractions, to be able to hold still for the epidural placement. That way we can place the epidural as safely as possible. What happens is some women wait till they're very far progressed into their labor, and pain can be hard to get control over at that point. And it's hard for women to hold still, which happens during late stages of labor. So we can still work with a woman at that point during their labor. We do it, we're very experienced at it, and we can place an epidural pretty much from any point a woman goes into labor. The point when it's too late is when you're actually pushing out the baby.